Hi, and welcome to Academic English. Today we're going to look at CELBAN. We will discuss the format of the exam, so an overview. We will look at sample tasks and even some exam practice material that CELBAN Center has on their website. As you know, CELBAN stands for the Canadian English Language Benchmarks Assessment for Nurses. It is an exam specifically designed for nurses. So everything in the exam, all the topics are related to your job as a nurse. And it offers a proof of language ability to the regulatory bodies when you get your credentials approved. Now, the group test, which includes listening, writing, and reading, is about 2.5 hours. It is part of the online assessment. And then you have the speaking assessment or the speaking interview, which is a virtual interview. This could come before the group test or after the group test, sometimes on the same day, sometimes on separate days. So let's go to the listening. I have some notes here on the side just to make sure I'm not forgetting anything. So let's go through it. In terms of the length of the listening, it is about 45 minutes. In total, you have 13 to 14 tasks between 30 seconds long and 3.5 minutes long. The number of questions varies from task to task. So for the 30-second tasks, you would probably have 1 or 2 questions. Meanwhile, for the 3.5 minutes long tasks, you will have around 12 questions. These are a combination of audios and videos. Pace is also varied between the tasks. So some of them are a little bit more fast-paced and some of them are more normal pace. These audios and videos, they are conversations or talks between nurses and patients, nurses and family members of the patients, or other healthcare professionals. All the tasks have multiple choice questions. The last addition, which it's been a few years now, is also a symptoms chart completion. You will get a chart with symptoms and you will need to fill in the words. The audios and videos play on the screen. As you listen or while you listen, you go along and answer the questions as well. You have time before to look at the questions, and then they give you time at the end of each audio and video to check your answers. It is important for the CELBAN to choose your answer as soon as you hear it. And in the listening exam online, they give you an option to flag a question. So if you're not certain of the answer, just flag the question and come back to it later. Sometimes, depending on how you progress through the exam, you may have some time at the end and you can go back through each task and check the answers, answer the questions that you flagged, and also sometimes you can even rewatch some of the videos, depending on how you manage your time. You also have a timer on the screen, so you can always see your time. Okay, so the types of questions for CELBAN are asking you for various things. First is just factual information. These are the easiest questions. For example, one question could be, according to the patient, what is his pain level? There could be also questions about the purpose of the dialogue. An example could be, why did the patient phone the clinic today? They also ask you about patient's mood or attitude. How does the patient feel? Meaning mood, because the answer choices will be frustrated, angry, at ease, and so on. There's questions that are checking that you understand advice or suggestions. There's also questions asking about the patient's condition or concern or problem. The writing is 40 minutes long and you basically manage your time by yourself. You have 2 tasks which are related to healthcare. In task 1, they give you a chart, which is an incident. And based on that chart, you will need to write a report in full, complete, grammatically accurate sentences. In task 2, it is a letter writing in which you have to give an opinion about a health related issue and give support to your opinion. They will give you some information on the topic and then they will ask you to write a letter. We're going to take a look at these in a little bit. In terms of how your response is evaluated, first you have task response, and this is basically how well your writing meets the task requirement. Basically, whatever they ask you to do, were you able to achieve it or not? For the second one, content and organization, this has to do with whether the examiner is able to read your incident report and understand what happened, or read your letter and understand what is your opinion and understand why you have that opinion, or what is your proof supporting your opinion. When it comes to grammatical structures, they look at your sentence structure and how well you use a variety of sentence structures, how accurately you use verb tenses, pronouns, and so on. When it comes to vocabulary, they want to make sure that you understand medical vocabulary and you can use it accurately. Not very advanced medical vocabulary, but obviously in the instant report, you will need to use the medical terminology that they give you in the chart, and also general vocabulary, how well you use it and what's your range of vocabulary. And the last one is fluency. This is the use of cohesive devices and how well your writing is organized, how well your ideas are organized, how do they flow from one to another. The reading task, right? So for the reading tasks, again, you have 40 minutes, and again, you need to manage your time by yourself. Roughly, I would say about 10 minutes per task, because you have 4 tasks. All the reading passages are on health-related topics. So you will have charts, patient notes, manuals, and short articles. Task 1 to 3, basically you have to read the passage and answer multiple choice questions. And task 4 is a little bit different. Here you will have a passage with blanks, so there's missing words in the passage. And then you have multiple choice questions in which you have to choose the best word for the missing blank in the passage. This is where they usually look at vocabulary, grammar, idioms, and so on. There are about 6 to 10 questions per passage, but it's not always the same. And each exam doesn't always have the same number of questions. You don't get a point off if you misanswer any question. You just get points for every correct question that you get. The questions are again about the main idea of the passage, synthesizing. They ask for factual information. Sometimes they ask you to make inferences. What did the writer probably mean by? There's also vocabulary questions and grammar questions. In the reading exam, they give you some tools which you don't have for the listening, but they give you a highlighter option for the online exam. Also, they give you an option to strike the answers. More often than not, in the CELBAN exam, the multiple choice questions typically have answers that are not mentioned or that are the opposite of what you read in the passage. So you can strike those immediately, and it's usually between 2 answers that you have to think about and find in a passage and answer. It's always 2. Even though you have 4 options, usually it's between 2 of them. They also give you a scratch pad to take any notes as you read. I'm not sure how efficient that is based on the time restriction that you have. Maybe you can let me know in the comments, how did you find the scratch pad, or if you used the scratch pad at all as you were doing the exam. The speaking exam is a virtual interview of around 35 minutes. It increases in the level of difficulty. For example, at the beginning you have simple introductions, like what is your name, what country are you from, and then you have descriptive questions, like tell me about the city that you grew up in. Then you have the role plays, which is role play 1 is a patient interview. They give you an empty chart. Well, you have some words on the sides, birthday, reason for visit, and so on. And then you need to ask the patient questions to get information. And role play 2, this is a discharge scenario. So you basically give the patient instructions about care after discharge. They give you some short instructions, about 4 to 5, and then you need to give the patient the instructions. Role play 3, it's an advice question in which, or scenario in which your coworker comes to you asking for advice of a particular situation, and you need to help them, or you need to give them advice. And then you have the opinion questions at the end, which are a little bit more challenging than the beginning questions. They could be asking you to compare something. They could be asking you your opinion on a particular topic related to healthcare. Now, there used to be 2 examiners conducting the interview, but now you have the interview online with 1 examiner, and then another examiner listens to the recording and marks the recording. If you apply for a rescore, then there's another examiner that comes in to mark it. Now for the evaluation criteria is a bit lengthy, but let's go through it. So first is the overall performance. The examiners are looking here for how well the conversation flows and also if you've used the correct language as you conducted the interview. This is particularly important for role play 1, role play 2, role play 3, when you're supposed to be interacting with a patient or a coworker. Okay, next is intelligibility. Here the examiner is looking at your pace. So do you speak too fast or do you speak too slow with too many pauses in between? They're also looking at your intonation and pronunciation of words. Grammar is quite easy, not easy to produce, but to understand what they need. They're looking at accuracy, how well you use your grammar or how accurately you use your grammar, looking for verb tenses, prepositions, pronouns, sentence structure overall, especially for role play 1, they're looking at how you form the questions in a grammatically correct way. Next, we have vocabulary. This is how well you use the health-related terms and general vocabulary in your speaking interview. Then you have the organization. If you're able to organize your response in a way that the examiner understands what's your opinion, what's your stance, or for the descriptive question, how you describe something in an organized way. For the role plays, it's a little bit different. There's a particular organization that CELBAN needs or is looking for in terms of the role play. So role play 1 has a certain organization to it, and role play 2 has a different one, role play 3, and so on. Some of the videos that I've already posted, they're on the role plays, so you can go take a look at those. Then the strategies. This is especially for the role plays, how well you're able to apply these strategies in your interaction with the patient. Some of the strategies are showing empathy. The social cultural criteria, it looks at how you interact with the patient, especially in the role plays, role play 1 and role play 2, how you interact with your coworker in role play 3, and also how you interact with the interviewer. But that's not as important. The important part that they're looking for is how you interact with your patient and how you interact with your coworker. Are you able to establish rapport? Are you able to connect with the speaker as you perform the role plays? These are very important. Okay, the scores. The scores needed for nurses by the regulatory bodies are 9 for listening. It used to be 10, so that's good that they've lowered it. 7 for writing, which is quite easy to achieve. Reading 8, again, not difficult to achieve. And speaking 8, which with the right strategies and practice, you can definitely achieve that. You will get an official and unofficial report in 15 days. The unofficial scores are for you. They also come with a report on your strengths and weaknesses, especially for writing and speaking. And the official the official scores are for the regulatory body. So when you register for the exam, you need to choose where do you want your scores to be sent. Keep in mind that those scores are only valid for 6 months in most cases. So I would advise not to take CELBAN until you're in the step in the process with registering with the regulatory body when they ask you for the CELBAN exam. They also can send additional scores. They charge a fee. I'm not sure how much that is, but if you need official tests sent to another institution, you can ask for that. You can also ask for a tax receipt. If you're unhappy with your scores and you think that you definitely did better than the score that you received, you could apply for a rescore within 20 days after taking the exam. The fee is, I believe, 125 Canadian dollars. And if the score is changed, they will refund the fee. If not, they get to keep it. Okay, so let's look at some samples. The CELBAN Center has 2 options for you to practice with. You could do the free demo of the exam, or you could pay the $57.92 plus tax to do a practice exam that is assessed in terms of speaking and writing, I think they give you scores for speaking and writing before you do the actual exam. Okay, so looking at the exam, it's a really good idea to do this before taking the actual exam so that you get familiarized with the format of the online exam. Also, they test your computer to see if it's compatible to do the actual exam. So good idea to go through it. As you can see, you can click on start a test immediately, but I would strongly advise you to go through the instructions and see what the buttons are and how they work and how you can use those to your advantage as you take the exam. There's a short tutorial that you can take about using the mouse. You can also test your mouse to see that it works. It's telling you how the next button works. Also about the timer, which you can see up here as well. Remember, we talked about the fact that you can flag questions and come back to them later. They tell you here how that button works and where to find it. You can also highlight. Remember the highlighting option? They tell you how that works as well. I believe the highlighting option is a very good option for the reading passages. Okay. The striking out tool, basically if you click right, you strike out answers. So it says how many lungs does the typical human body have? You can already strike those. Right? And you know B is the correct answer. Okay, it's also telling you that you will need to scroll so you don't miss any of the text or any of the questions. So whenever you see this button, you know that you need to scroll down so you don't miss any questions. It's telling you how to answer multiple choice questions, also that you can go back and forth if you still have time, how to answer the essay question. There's a word count there as well for you. You could test your keyboard as well, make sure it works. How to answer the chart type questions for the listening. It says here you need to put an X next to the symptoms as you hear them. And you see here it says the page requires scrolling. So that means make sure you go all the way down just to double check that you didn't miss any questions. Okay, this is about the video scenario. It's basically telling you that you cannot pause or stop or replay the video until you finish the task. If you still have time at the end, you can go back and do that. You can even rewatch some of the videos or re-listen to some of the audios. But while they're playing, you cannot stop it or go back and listen to it. Okay? You just have to go through the tasks. And if you have time at the end, you can go back to listen to it again. About the reading passages, they're telling you that there will be a PDF that will come up. So you have the questions in this window, and then another window will be the PDF. This is how it looks like. Incidentally, this is a sample incident report for the writing. The writing also has the PDF. So the incident report will be in a PDF, and then where you type, it will be the main window. I would advise to have a bigger screen to do this because on a small laptop, it's probably going to be quite challenging to do, especially because you cannot have them next to each other. You could also give feedback at the end based on your experience. And that's it for the tutorial. Now we can go on and start the test. So these are the instructions for the listening. It says you have 9 minutes to read the instructions and complete the 3 tasks. Obviously, in the exam, there's a lot more than that. It says in each task, you will be presented with a video on screen. The video will play automatically. You will have some time to read the questions before each recording begins and time to check your answers afterwards. You will not be able to pause, stop, or replay the video while you're completing the task. Follow the instructions in the video, countdown, timer. Click next to proceed to the next task. And it says after you have completed all the tasks in the listening section, you may have some time remaining and you can go back, check your answers, especially for the flagged questions, and you can even replay some of the videos or audios. Okay, task 1 of 3, instructions. You will listen to a short video recorded conversation and answer 3 questions.
Read the questions.
So what is the family member most concerned about? What is the current status of the patient's cancer? What will happen tomorrow?
Listen to the recording and select your answers.
Hello, Mrs. Hawkins. I see you just arrived from emergency. How are you feeling?
Where am I? I don't know why I'm here.
She doesn't exactly know what's happening. We're quite concerned about the chemotherapy and how the pneumonia might be affecting it. She's right in the middle of chemo.
I see. Well, we'll be concentrating on clearing up her pneumonia first, and then the doctors will decide what's best for her.
Actually, we're quite concerned about whether or not she should continue with the chemo treatment. Her cancer's become much more aggressive, and the chemo can't seem to keep up with the cancer.
I see you're worried what this would mean in terms of fighting the cancer. I understand your concern.
Exactly. I mean, will you be consulting with the oncologist about her condition?
Yes, the doctor will be around tomorrow morning, and he'll let the oncologist know that she's here.
Okay.
Check your answers.
Okay, so then you have some time to check your answers. Question number 1, the family member is most concerned about the chemotherapy, how it will interact with the pneumonia, but also it seems that the chemo is not really working. The cancer is more aggressive, and what will happen tomorrow? The doctor will speak with the oncologist. Next, task 2 of 3, you will listen to an audio recorded conversation, and you will have to complete the symptom chart. Type an X in the chart to indicate whether the symptom is more severe, less severe, but still present, not changed, or gone.
Look over the chart.
Okay, let's look at the chart. So headache, stomach pain, arm pain, more severe, less severe, but still there, no change, or gone.
Listen to the recording and select your answers.
Good morning, Alex. How are you today?
Terrible. I have such a bad headache.
Well, remember, you had a concussion. Your brain is still recovering from the fall. Is it any better than last night?
Maybe a little. I think a Tylenol would really help, though.
Sure, I can get you some Tylenol. Do you want something to eat as well?
I don't know. I'm not really hungry.
Well, when you came in last night, you felt like you were going to throw up, so you didn't eat anything. Do you still feel queasy?
Yeah, I guess. I don't want to think about eating.
Okay, we'll hold off on food then. I can bring you a granola bar in case your stomach feels better later this morning. And I'll bring you more water. Try to keep drinking. How is your arm today? Still sore?
It hurts even more. I can't move it without pain. I think it's broken.
Well, you did land on it when you fell at skating, but the x-ray shows it's not broken. I think the Tylenol will help for that, too. I'll go and get some. Be right back.
Check your answers.
Okay, so in terms of the headache, he says it's less but still present. Stomach pain, the correct answer is same, no change. Cannot think about food. Still feel like throwing up. And the arm pain seems more severe. Task 3 of 3, you will listen to an audio recorded shift report. While listening, select the correct answers from the options provided for each question.
Look over the questions.
Okay, so we have Mrs. Thompson, room 214A, 214B, Mrs. Saunders, 217B, Mr. Sanchez.
Listen to the recording and select your answers.
This is the evening shift report for Monday, October 21st. Room 214A, Mrs. Thompson. The mental health team visited and new orders received. It was really just to do her October weight. 214B, Mrs. Saunders. Went to physio for the first time before supper. It went well. No visible swelling or complaints of pain. Room 217B, Mr. Sanchez is starting to get up and walk a lot. He's certainly more cheerful now, so it's good to see him getting back to normal. So it was a good evening. See you.
Check your answers.
For Mrs. Thompson, they were talking about the mental health team having an assessment. Mrs. Saunders, there was no complaint of pain, said no swelling. Mr. Sanchez is more mobile, he walked around. You notice that in these types of questions, they mention everything, but some of them are opposite of what's in the answer choices. So you have to be extra careful with these. Okay, and that's the listening. Now, because you have some time left, you could go back. So let's say if you want to rewatch the video, you could do
Read
that
the questions.
if the time allows. It will basically start from the beginning.
Listen to the recording and select your answers.
Hello, Mrs. Hawkins. I see you just arrived from emergency. How are you feeling?
Where am I? I don't know why I'm here.
She doesn't exactly know what's happening. We're quite concerned about the chemotherapy and how the pneumonia might be affecting it. She's right in the middle of chemo.
I see. Well, we'll be concentrating on clearing up her pneumonia first, and then the doctors will decide what's best for her.
Actually, we're quite concerned about whether or not she should continue with the chemo treatment. Her cancer's become much more aggressive, and the chemo can't seem to keep up with the cancer.
I see you're worried what this would mean.
Okay, so our time is finished. Hopefully you were able to check the answers, and hopefully in your actual exam you have a little bit more time at the end because you won't be talking at the same time. You will have a little bit more time to go back and actually watch and listen to the videos again. As you can see, our next section already started automatically. So if you don't want to miss too much time, you can jump straight into it. It says there are two tasks in this section. Your first task is a reading passage, and the second is a fill in the blanks task. You have 9 minutes to read the instructions and complete the two tasks. As you can see, we're already down to 8. So always keep an eye on the time. And it says answer the questions based on the information in the passage. For the first task, you may proceed to the next task. Task 1. You see what I mean about the PDF? You have the PDF here and the task. You could move the PDF around, but you cannot have them side by side. So we're going to try to move it around a little bit out of the way. Remember, you can highlight. There's a highlighter button. And there's a striking button for the answers that don't make sense. You can also flag questions. Let me close the PDF a little bit to show you that. You see the flag buttons. If you want to flag it, then you can come back to it later. Going back to the PDF. So the question says, not that you can see it, but the question says, what is the best synonym for the word paradigm in the second paragraph? Okay, PDF. Okay, the paradigm shift comes with challenges. The whole passage is about paradigm. If you keep reading, there will be a synonym in there. And as you can see in the second sentence here, it says, patients need to recognize that their health depends on a model of prevention. So paradigm is model. Okay, next it says, one of the greatest challenges to the wellness paradigm may come from. So we're looking for keywords challenges, and in here we already know that we saw that before, challenges. It says, this paradigm shift comes with challenges. Along with nurses' shift in thinking and practice, it requires patience, understanding, and commitment. Patients need to recognize that their health depends on a model of prevention and on continuous self-care through exercise, healthy eating, and disease monitoring. So what do you think is the greatest challenge? It doesn't talk about drug companies, so you can strike that. It doesn't talk about healthcare centers, you can strike that. So is it the local educators or nurses, or is it the patients themselves? As you can see, nurses, they only mention it very briefly here, shift in practice, right? But for the patients, the highlighter tool. For the patients, it focuses on a lot more. So they need to recognize their health depends on prevention, self-care, exercise, healthy eating, disease monitoring. So best answer is patients themselves. Next question. I wish they had the passage next to each other. This is not very practical. What is the author's attitude about the potential success of the wellness paradigm? So we're looking at attitude for potential success. Let's try to find that keyword, success. So in the last paragraph, remember the questions go in the order of the passage. So there's no point in going to paragraph 1 because it goes in the order of the passage. It says the idea of wellness differs from individuals and across cultures, patients' realities, their environments, genetics, experiences, age, emotional balance, family support, and intellectual abilities determine their perception of wellness. And then in multicultural Canada, cultures can have varying concepts of health, healthy food, exercise, stress management, and disease treatment and prevention. And then it says, in the face of such diversity, how do nurses approach the practice of wellness? So do you think the author is confident, pessimistic, enthusiastic, or cautious? Based on this paragraph, I would say cautious. Again, the PDF is telling you you need to scroll down, so make sure you don't miss any of the passage. And these are the questions. It says, rabies is a virus-produced disease that causes swift destruction of the nerve cells in the hindbrain. Although it is usually carried to humans by dogs, other animals also spread the infection. After a person is bitten and blank, the disease usually requires from 8 weeks to develop. So after a person is bitten and you need a past participle because bitten is a past participle. So a person is bitten and injured, disinfected, festered, infected. So what happens after being bitten? And we're talking about rabies, right? Obviously not disinfected, not injured, although it could work, but in this case, we're talking about infection, which is rabies. Infected is the best option. It requires from 8 weeks. That you need here is 2, from this to this. But it blank lie dormant for as long as blank year. So, but it must, may, should, or will. And it talks about the future. So you're being bitten, the infection is there, but it's dormant. So will lie dormant for as long as the year, a year, 2 year, an year. Obviously, the only one that works here is grammatically. You cannot say the year, you cannot say an year, and it cannot be 2 year because year is singular, so it has to be a year. In most cases, the incubation blank is shortest when there are deep blank on the neck, head, and face. So in most cases, the incubation period, month, probation, or isolation. We know that incubation period is an expression that goes together, so it can only be period. It's a collocation. When there are deep blank on the neck, head, and face. So think about rabies, apply your logic, your common knowledge on the disease, and what do you see on the neck, head, and face? Stings? No. Bites? No. Scars? Yeah, it's between scars and rash. But because in here it says there are, it cannot be rash because rash is singular. So scars is the only answer that works. Good. That was the end of the reading. You could continue to do the writing if you wish to online on the CELBAN Center website. However, the writing that I have for the unpaid version of the practice exam doesn't accurately reflect the actual exam. You could check the videos that I've posted before in terms of writing task 1, writing task 2, for the role plays as well for the speaking, but this was just an introduction. Next, we will discuss the IELTS versus CELBAN and see which test is easier in terms of achieving the scores that you need for the regulatory bodies. Thank you for being here today, and we'll see you in the next video. Bye bye.